County Democratic Party that enabled our volunteers to make tens of thousands of contacts into our communities. And really want to thank Governor Newsom and the California Democratic Congressional Delegation, as well as our colleagues in the state legislature and the partners all across the state. Everybody stayed united and focused. I wish we hadn't needed Proposition 50. I've said this many times, but when one state draws maps designed to silence millions of voters, and the partners all across the state, everybody stayed united and focused. I wish we hadn't needed Proposition 50. I've said this many times. Now we look ahead. 1 year from now, we're going to be choosing the next House of Representatives, and we have momentum, but we also have a lot of work to do. I hope we can take the energy forward, and we can have a big victory next year, because failure really is not an option. We have to put a check on this administration. So with that, I want to say good morning again, everybody. Kyle, you ready? Good. I want to thank everybody for being here today, and I want to really welcome our constituent, Brooks Thomas, who you're going to be hearing from, and Dr. Bob Bridgestone, my dear friend from the San Diego County Medical Society. Thank you so much for joining me today. I want to thank our great elected officials from Solana Beach who are here as well. They make it so easy and wonderful to represent Solana Beach. So thank you, Chris Becker and Joel Edson, for everything that you do for our community. November 1st, I think everybody knows, marked the beginning of open enrollment for the Affordable Care Act. And in California, there are roughly 2 million Californians who received a letter similar to the one over there that indicated what the 2026 premiums would be. And the numbers across the country are alarming. This chart, I think, says it very well. In 2025, the average premium for someone getting their coverage through the ACA was $888 a year, and now in 2026, it's going to be $1,904 a year. So we're talking about a huge increase. That's, again, this is real world. This is happening right now. Over 20 million people with ACA plans are seeing right now what we've been warning about for the past few months, that health insurance premiums are skyrocketing. And that's because the tax credits that have kept premiums affordable for the last number of years are expiring at the end of the year unless Congress comes together to extend them. Without these credits, the estimates are that 660,000 Californians will simply not be able to afford health insurance at all. They'll be priced out of the market. And it's roughly 8,000 people in our congressional district alone, several tens of thousands throughout San Diego. 5 million Americans across the country will be priced out of health insurance without these credits. And that impacts us all. If these folks no longer have health insurance and they still have acute care needs, you can ask Dr. Bridgestone, they're still eventually going to wind up in the hospital and without that preventative care, without the early diagnoses, without the proper testing that we all get all the time. That's the American healthcare system. We're all in this together. So if you all of a sudden have 5 million additional uninsured, it is bad for everyone. As soon as we saw that it was likely that these credits were not going to be extended, I started asking our constituents what they were hearing, what they were seeing in their letters. You're going to hear from one in a minute, but I've spoken with scores of constituents over the past couple of months, and the stories are incredibly alarming. One constituent, who's a small business owner, said that to cover her family, she's 51, her husband's 52, and her 2 kids, 17 and 18 years old, their health care premiums will go from $26,000 a year for the family to over $55,000 a year. Just want to say that again, a family of 4, this was actually a constituent in Solana Beach, would face a $55,000 bill just for health care premiums if the tax credits aren't extended. Another constituent said that she had served in the federal government for a number of years, and she was laid off as part of the DOGE cuts back in February. So she found a plan through Covered California, and she has been paying $125 a month for her health care. Next year, that will go to over $300 a month, nearly 3 times what she's paying right now. And the costs go beyond premiums, of course. I've heard from constituents whose deductibles are also increasing by many thousands of dollars. Parents are going to have to pay hundreds more a month just to take their kids to the doctor. It's going to lead to people skipping visits. Simple as that, just because they can't afford it. And for millions of families, including our neighbors, it's going to mean having to choose between having to pay for health care, for groceries, or for rent. The tax credits are not abstract. Speaker Mike Johnson and congressional Republicans' decision not to extend them will hurt families. And we actually have plenty of Republican members that want these credits extended as well. It's just that Speaker Johnson will not let them negotiate with us. He won't even allow the members on their side to even go back to Washington, D.C. I think this is day 46 or 47 without any of the rank and file congressional Republicans actually in Washington, D.C. to negotiate anything at all. One of our constituents told me, and I quote, "Covering California has been a godsend. With the ACA credits, I've been able to afford care for my family as I started my own business, but I'm terrified what will happen if those credits expire," end quote. This fear is real. This is not theoretical. It's about to hit tens of thousands of Californians, tens of thousands of San Diegans, hundreds of thousands of Californians, millions of Americans if Congress fails to act. And it's also overwhelmingly popular. 78% of Americans, including majorities of Republicans and majorities of Trump supporters, want to see Congress extend these credits. So look, we've got to come together. I'm on the Appropriations Committee. I can tell you it's been infuriating not to be able to negotiate at all with any of my colleagues across the aisle now for 6 weeks. We've got to do it to save health care. We've got to do it to make sure people have enough to eat. We've got to do it to make sure our federal workers are getting paid and that the government is up and running again. And it's been extraordinarily disappointing. So with that, I'm going to introduce our constituent, Brooks. If you could come up and you could share your story, I would be very grateful, and then we'll hear from Dr. Hertzstedt. Brooks.
All right, I'm just going to read this letter that I wrote to the congressman. My name is John Brooks Thomas. My friend is Paul Brooks. I'm 54. I'm divorced. I'm in graduate school at National University getting an MA in psychology, and I'm living alone for the first time in 25 years. Calgary, California previously allowed me to get coverage when my ex-husband and I left our careers and we started the real estate business in 2014. After our separation and divorce last year, I was able to get employer health care for most of 2024, and this year I was bumped on the Medi-Cal for the first half of the year because my only income was 1099 self-employment contract labor working as a design consultant before I started graduate school. I've been unable to keep the 1099 contract while I started school. This year, when I was finally able to get on the California exchange, I've been paying $489 a month for volunteer PPO. So I've been living mainly on a small withdrawal from my retirement accounts and federal student loans. Last week, I received a notice from California that my premium would increase in 2026 by approximately 94%, going up to $949 a month. Or I could accept a lower price option of Kaiser HMO that my doctors accept for $703 a month. I'm in a one-bedroom apartment that's around the average rent in San Diego for $2,500 a month. Plan to find a roommate as soon as my lease is up. Frankly, can't really afford to spend $489 a month now, but definitely will be unable to spend almost $12,000 a year for health insurance next year. Not sure what my options are to continue my studies as a full-time student that doesn't offer, at a university that doesn't offer health plans for their students. I can quit that and go back to work or move out of state. I don't think people are hearing enough about this and how it's going to affect people like me and people much less fortunate than me. There were several notices from California earlier this year that did announce that premiums would rise and that there'd be zero pre-tax subsidies, but the latest letters I've received say very little about the reason why the premiums are changing. Thank you.
Well, thank you so much, Brooks. I now want to hear from one of the real leaders that I turn to for information and for understanding of the American healthcare system, which is extraordinarily complicated. And I'm excited that after last night, he will be my constituent again. Assuming that the election goes well next year, and that's my good friend, Dr. Robert Hertzstedt.
All right. Let me see. There always be good news. I used to be a constituent, and then you threw me out. Now I'm back. This is good. All right. This is a very serious issue, and Congressman Levin has really enhanced tax credits or subsidies, all these words we use, but basically the additional federal dollars that the Biden administration put in to the Obamacare health exchange system allowed growth in covered California here to go from 1.5 million to 2 million people. That's 500,000 people that now have been able to afford decent health coverage. Some of these people are in the middle of their treatment for a condition, or they could have even just had surgery and they need 6 months of physical therapy that requires coverage. And they're going to have to change their doctors. They're going to have to, the disruption in people already getting health care, and in addition to that, the people who won't seek health care because they no longer have policies. So actually, this is, if you're in the health policy world, we've known this for 5 years that this was coming, because this was a 5-year deal. In fact, when we were in a snowstorm in your office, this is one of the topics when I brought a group of doctors in, that we're gonna have to look for this, and we knew you would pay attention to it, but this is like, if any of you have had kids and the term paper, they start on the last night of the year, they start working on their term paper. Well, sometimes those students fail and they learn a lesson, and that's, no lives are lost. But Congress is treating this like a kid on an all-nighter for a term paper. And this probably will be solved in the dead of night on December 30th, but for no good reason. And so in the physician community, we're very upset. We have patients in these situations that we're working with and dealing with, and we really hope that one way or another, and I would agree that I've met plenty of Republicans that want to fix this, but everybody's been frozen out. And we really want to address this. Certainly the physician community, we're willing to step up and help do whatever we can. And I really appreciate Congressman Levin's leadership on this issue. Thank you for doing this morning.
Thank you, Bob.
All right, appreciate you. Okay.
So one other thing that I'd like to mention before we close, and that's food assistance in our community. After we close here, I'm going to go up to Encinitas and volunteer myself at one of our local food distributions. It is inconceivable to me, but the administration has decided to continue to push back on now a court order that they use $4.7 billion in additional funds that are available for emergencies. We appropriated these funds in the last 2 fiscal years specifically for situations like the government shutdown. There are 42 million Americans that rely on SNAP, called CalFresh in California, around 5.5 million Californians, and around 400,000, just under 400,000 folks in San Diego County are impacted by this. And for those that rely on food assistance, this weekend when they check their balance of their CalFresh EBT card, it in many cases had insufficient funds to buy the groceries that people need to make sure they have enough on the table for their kids. This is so offensive to me because I've gotten to know a lot of the people who are on CalFresh in our community. These are the disabled veterans who have served their country, who aren't able to work full time. These are the single moms who are working but aren't able to cover all the rent and expenses that in San Diego can add up quite quickly. These are people who really do need the help. This is not a handout. These are not folks who are undeserving. And it's the least we can do in a place like San Diego to make sure that people have enough to eat, for goodness sake. So I'm going to go volunteer right now, and I'm going to continue to call on the administration, specifically the U.S. Department of Agriculture, to stop these games. We should never, never, never leverage hunger as a political tool during a government shutdown or any other time, particularly the hunger of kids. When you're talking about the 42 million that you hear on SNAP, 16 million of those are children, and 1 million of those are veterans. So I find the whole thing deeply offensive, and I look forward to getting back to Washington, D.C. whenever and wherever possible. I'm ready to go on the next flight today because we have to get the government reopened, but that requires an actual give and take. It requires an actual dialogue with people of both parties. And unlike in the Senate, where both John Thune and Chuck Schumer, to their credit, have empowered individual members to go and have at least a dialogue about extending the ACA tax credits, about actually having an appropriations process funding the government. In the House, Mike Johnson has decided, I don't know, too risky. I don't know why. He has called for the last 6 weeks for his members to stay home rather than come to DC. And I never thought that I would agree with Marjorie Taylor Greene so much, but she's made sense lately when she's talked about the need to fix this ACA tax credit issue, to have a plan on health insurance, and to actually get back together and negotiate in a good faith bipartisan way. That's the only way that we get anything done that lasts in Congress. So with that, I will stop. Any questions? No questions? Thank you. Good to see you guys. Thank you, thank you. All right, good job. Thank you.